I'm Judd W. I'm a urologist, urologic oncologist at Duke University Medical Center in Durham. And our research and our Duke Prostate Center is a multidisciplinary program. And my main area is prostate cancer. And I would say about 90% of the patients that I see are localized disease patients. And, I do about 125 radical prostatectomies per year. And that's been kind of my consistent pattern over the last 15 years at Duke. We've been using the Decipher post-radical prostatectomy test, I think now for the last 3 or 4 years. We've probably done somewhere in the range of over 300 cases. And we typically order the Decipher on patients who meet the on-label indications of adverse pathology after radical prostatectomy, or some of the patients may have a rising PSA and we're ordering the Decipher test slightly later. But I would say the majority of our cases have been ordered when we get the pathology back, and then I will have the Decipher result to go over with the patient when he comes back for his 3-month office visit. So I'll do the PSA test, my first post-op PSA at 3 months post-op, and then I'll also have the Decipher report to go over. Now, I've already gone over the regular pathology report with that patient at his 2-week office visit after his surgery. But then at the 3-month visit, most of the time I'll have the Decipher report to go over with that patient. It allows me to have a more in-depth discussion with the patient about his individualized risk for recurrence. Certainly if the Decipher comes back low risk, that's a very reassuring conversation. And many times that's gives the patient an opportunity to, pat himself on the back, and we have a good chat about he made the right decision and he's low risk and life goes on. But for the high risk patients, that's also an interesting conversation to talk about, following them perhaps a little more closely, or potentially having them see the radiation oncologist, having a more in-depth discussion about adjuvant therapies, or even in certain really high risk cases, those patients go immediately to medical oncology for consideration, say, of maybe PET scanning or other novel treatments such as abiraterone. So it's a downstream effect, especially for the very high-risk patients, because those patients are then getting the multidisciplinary care. Almost all the patients who have a adverse pathology after radical prostatectomy, especially, significant adverse pathology, since we practice in a multidisciplinary clinic, I will send most of those patients to radiation oncology for counseling, whether or not, or even before the Decipher test results come back, because we practice in that environment. But I'm also comfortable because our radiation oncologists are very familiar with these new clinical trials and don't automatically pull the trigger for adjuvant radiation. They have the same conversation I would about, possibly waiting for early salvage. So, but many times the patients, especially, the guys with seminal vesicle invasion or some of the, say, Gleason 8s with multifocal positive margins, the ones who are significantly higher risk, those men will go to radiation oncology simultaneously with me ordering the Decipher test. Because, like I said, I know that they're not automatically going to get shifted into radiation. Our team will wait for the Decipher results, and many times, most of those patients, I would say, end up being monitored and then receiving delayed radiation or early salvage if necessary.